challenging.
Lo que vamos observando es que la tasa de crecimiento de la pandemia,
What we are seeing is that the rate of increase from this pandemic is falling in practically all parts of the country, and this decrease is also reflected in the number of secondary infections. This is a very good indicator in epidemiological terms for us, and we will be monitoring carefully this decrease over the coming days.
Well, let's cross now to Graham Keeley, who is a journalist for The Independent, working from Madrid. Graham, thanks very much for talking to us. This is incredibly welcome news after a tragic and difficult ordeal for Spain.
Absolutely. It's been a very grim time, as you know very well. When you listen to the figures for today, of course, it means 600 people have lost their lives. But then you think about how it was just a few days ago when over 900 people had lost their lives in 24 hours. So it's very welcome news. There is cautious optimism.
I mean, it is a measure of what we've all come to in terms of our expectations, that we can even think of over 600 people dying in a day of a virus being relatively good news compared to, as you say, what was happening last week. But 13,000 deaths in total in Spain, a 3-week lockdown already, imposed until the end of the month. But as we've just been mentioning, some hopes of a glimmer at the end of the tunnel.
Absolutely, and it's significant that the government is beginning to think of de-escalating the lockdown. They are going to widen the testing, probably starting with essential workers who don't show symptoms, and then widening it so that perhaps we can envisage the lockdown being relaxed possibly by sometime into May. That seems realistic. However, I have to say that epidemiologists that I've spoken to have said, look, the government is not going to relax the lockdown until they see a significant decrease in the number of new cases, and that we haven't reached that yet, and possibly we're not near that yet.
And Graham, obviously testing, as you will be very aware, is hugely controversial here in the UK in terms of unavailability of tests for key sections of the workforce who feel that they need them, not just the frontline workers in hospitals.